Mark Johnny here. Today we're going to be doing a video on upper right quadrant intestinal pain. We'll kind of break that down, what it is and what it could be. Really excited to dive into this topic. Before we do, smash that like button. Really helps. Put your comments down below. Let me know if you have any thoughts or experience on the topic. Please share your thoughts. Really appreciate it. All right, dive in. Let's go. So first off, upper right intestinal pain. So we had to have, imagine we put a line from your sternum all the way down and then right across your belly button here, okay? I'll put an image up. And we'll do it that way. I'll put an image up. It'll be a lot easier for you guys to see. We'll break this down, what this actually looks like. Let's do this thing. Okay, so right here we've put our little line here right on the intestine, and we're going to cross the belly button right here, left to right, and then you can see right from the collarbone down. And so we have the left upper quadrant area, which is most of the stomach. So when we have heartburn and different upper left quadrant issues, you're going to see heartburn, gastritis, maybe esophagitis, because some of this just leans to that left upper quadrant. Now, for the purpose of this video, we're talking about right upper quadrant. You can see just over here, this is the right upper quadrant. You do have the bottom part of the stomach and the first part of the duodenum here. So it's very possible inflammation at the end of the stomach. I think that area is called, I think that part of the stomach is called the fundus. I think it's the antrum at the top and the fundus at the bottom. I could mix those up. And the bottom right here, this is going to be the duodenum, the first couple inches of the small intestines, the duodenum. So you could have a little bit of inferior gastric inflammation in the stomach. You could definitely have a little bit of start of a peptic ulcer that's creating that right upper quadrant pain. A lot of the times I would say, does it get worse with a meal? And is it burning? Is it burning pain? The next thing we have to look at, we can't ignore the gallbladder, right? So when you do like an abdominal kind of palpation, one of the signs where you go underneath the ribs, you have the patient take a deep breath in and then breathe out. And as you breathe out, the goal is that that diaphragm relaxes and you can kind of get your fingers underneath there and see if this gallbladder area is inflamed, right? If you have cholecystitis or some type of gallbladder inflammation, then that would be definitely a problem. Let me just real quick here for the sake of, here's our stomach just to be on the safe side. Okay. All right, very good. Yeah, so the top of the stomach is going to be the fundus. Yep, that is correct. So fundus is at the very, very top. Just to confirm that with you guys. All right, awesome. Just want to make sure we have the right anatomy going here. Just look at this one right here. Yep, that looks good. All right, and so you can see here, the very bottom part of the stomach, that's where we can start to have a lot of inflammation present, right? And that's where we can really create a lot of problems and a lot of gastritis. And so we have to differentially diagnose, what is happening here? Are we creating stomach inflammation or do we have gallbladder problems? Now, one of the first things to differentiate gallbladder inflammation, right? This is our liver gallbladder. The biggest thing to differentiate that is, do you have floating stools? If we're not breaking down fat adequately, it's possible that we're not going to be able to emulsify it. Therefore, it's going to be coming out in the stool. And what does fat and water do? They separate. And so you're going to see the oil sit on top. So you'll see floating stools potentially. You may notice just increased clay color or blonde color stools. That's possible. So keep an eye on that. Really look at the quality. You may notice just excessive streak marks on the stool because of the fat is creating streaking on the stool, or a lot of excessive wipes. And so you can always try a different meal. Try a lower fat meal, like a leaner chicken or a leaner fish. Keep the fat super, super low, if nothing at all. See if that changes or not. See if that kind of use that fat as a lever. You increase the fat, you're moving that lever up. We're seeing if that variable can make things get worse. If it doesn't, then it's probably going to be more on the stomach side. Now, again, when you have upper right quadrant inflammation and we look at this gallbladder area, it's very possible there could be a stone in there. And part of it is the gallbladder is compressing, trying to spit out bile. And bile is really important for emulsifying fat. Also, there are toxins in there too. So it's kind of how your body detoxifies. If there are any stones in there, it's possible that gallbladder could be hugging, kind of giving that porcupine a big hug and trying to push out that bile. And those stones could be really sharp and that could create inflammation. I've also just seen the gallbladder just generally get inflamed through autoimmune processes. You can see it with different, I don't know the exact name of the condition, but there's like a gallbladder issue where the gallbladder tubing out to the, I think it's the hepata ampulla, right? that ampulla starts to get very, very narrow and sclerotic. And there's an autoimmune component. I think it's like a component to it. I think it's like cholangitis. There's an autoimmune component though. And I've seen some scientific articles connecting that to gluten and grains. So it's possible that there could be inflammation in the tubing from the gallbladder going out into the small intestine. Very possible. Just general foods can create inflammation in that gallbladder area. Very possible too. Gluten. I've even seen some foods like pork and coffee can be problematic. Also, certain parasites like H. pylori, and I've even seen, well, H. pylori is with bacteria, but Giardia is a parasite that can get up there and create some inflammation too. And so, one of the big things we'll do is just to really work on thinning out the bile that's up there. We'll use beetroot and dandelion, phosphatidylcholine. We'll actually use ox bile to take stress off the gallbladder. And again, out of the gates, you really want to decrease the trigger. So, you may have to go lower fat for a bit. You may have to work on cutting out the food allergens that are aggravating it, just so we're not hugging that porcupine while we work on smoothing that out. And then the next thing is going to be the stomach. We would want to see, can we tolerate acidity? Can we add in apple cider vinegar, lemon juice? Okay, we can. Great. Maybe we can move into a hydrochloric acid with pepsin. Is that another possibility? And then from there, we can kind of move up and add in some enzymes. And we may want to look at doing some gut testing and seeing what's going on in the gut. Do we have bacterial overgrowth? Is there a general bacterial overgrowth in the stomach? I mean, you can run a conventional, or I should say a more functional test like a GI map. You could even run like a lactulose breath test that would look at more bacteria in the small intestine, or you can run a glucose breath test, which would look more at bacterial overgrowth in the stomach. So these are all really good options to look at for sure. Hope that helps. So in general, these are the upper right quadrant, gallbladder, lower part of stomach, peptic ulcer, first part of small intestine. The reason why someone gets a peptic ulcer is when you move all this acidic chyme in the stomach right here, you have to then alkalize it. You have to take it from a 2 or 3 pH and you have to bring it up to a 7. And the pancreas has to function very, very well and has to produce bicarbonate, baking soda essentially, to bring that pH up. So if we don't have a good functioning pancreas, that could be a problem. So taking systemic enzymes or taking pancreatic enzymes, proteolytic enzymes, lipolytic enzymes also help with the gallbladder too, but they're made by the pancreas, right? Pancreas has endocrine function, glucagon, insulin, but also exocrine function via proteolytic and lipolytic enzymes. And then also if we have a stone, so here's the gallbladder right here, you can see it. See if I can zoom in more. But essentially this connects right here, and behind it, this yellow guy right there, that is your pancreas. And this actually comes out the same tubing. This comes out, it's called the common hepatic bile duct. So you're going to have the pancreatic duct here is going to connect with the common bile duct. They're going to almost T together. And if we have a stone there, that could easily back up the enzymes, prevent the enzymes from coming out and then essentially backing up into the pancreas. So you can also create pancreas inflammation. You know, the big risk factor for that is excess alcohol, being an alcoholic typically, and then some type of a stone. So keep an eye on that. We want to make sure you don't have a pancreatitis issue as well. Again, we use herbs and nutrients to really help with that, cut out all the allergens and really work on reducing a lot of the inflammation. So hope that helps there out of the gates, y'all. So in general, if you have upper right quadrant pain, we got to look at the stomach. We got to look at the intestinal tract. Super important. Got to look at the gallbladder, right? Got to look at the first part of the small intestine. So we want to, one, work on better digestion, cut out the food allergens, make sure we don't have a gallbladder stone. Is your stool floating or sinking? Is it creating excessive street marks on the toilet paper, on the toilet seats? How are you doing with fat-based meals? Do you feel better with less fat? All these things matter. So we really have to do a really good history, lean into that, and figure out what the underlying root issues could be out of the gates. All right, very good. Let me see if I can have any questions on the topic, guys. I'm going to try to come in and just try to grab a couple of questions pertaining to the topic if you guys enjoy it. Let's see here. A couple of questions here, but they're not really relevant to the topic. So I really want to stay on topic here for everyone today. So if you guys enjoyed today's video, feel free to give me a thumbs up, put your comments down below. Again, when you kind of draw the quadrants, right? Upper left quadrant, definitely going to be more stomach. When you go to the upper right quadrant, we're definitely looking at stomach, small intestine, right? Stomach, small intestine, lower part of stomach, upper part of small intestine, and then gallbladder areas too. And we got to rule out the bacteria, got to rule out the parasites, got to rule out the inability to break down fat/stones, and got to rule out the inflammation caused by food could be a significant driving factor. So I hope you guys enjoyed that out of the gate. Question here. Does taking bile salts on an empty stomach help with thinning out the bile? I mean, the things that we use to help thin out the bile are going to be one, decreasing estrogen levels. So if you're a female, high levels of estrogen can cause problems that can make your essentially your bile much more dudgy. We may add in things like beetroot and phosphatidylcholine and dandelion to help thin it out. Some fringe tree extract in my supplement line. We're going to use liver supreme to kind of help thin that out. We may even use a herb called Stonebreaker. It's a Pianca Chiadra herb, very helpful there. Those are a couple things. We may go a little bit lower fat if there is a little porcupine in the gallbladder, so to speak, if there's a stone there, just so we're not creating inflammation. It just depends upon how acute someone's inflammation is when they eat fat. Okay, very good. And of course, yeah, if you're having the excess of wipes, the first thing we're going to do is add in some bile salts and some enzymes that are high in lipase for sure. Very good. One more question here. Go on. What do you think of a spore biotics on an empty stomach? So typically spore biotics are going to be acid resistant. These are going to be the Bacillus strains, Bacillus coagulans, Bacillus licheniformis, subtilis, Clausii. They're acid resistant. So typically you're going to take these with food. They're acid resistant strains as well. Does fiber make your stool less streaky? Yeah, fiber can. It definitely can. It can definitely make your stools float more as well. And it may not necessarily be because of a fat issue if you're doing a lot. Like if you're doing a big fiber in your smoothie or you're having tons of like a huge salad, some of that can definitely give you a false negative on it. That's why you really want to look at the streaking, the floating aspect, does it look clay or blonde colored at all, the wiping, all those things as well. If the wipes are pretty good and there's no streaking, it could be a fiber issue. You can just adjust that, just decrease the amount of fiber you have and see if that problem still exists. That's helpful. Good questions here, y'all. What's causing my metabolism and digestion issues when it comes to food? Oh, my, too much of a broad question. So, out of the gates, go look at any of my podcasts on digestion. But anytime you have poor digestion, then you're not breaking down the food for a lot of different reasons: food allergens, gut bug, low enzyme, low acid, low bile. That food's going to rot inside of you, and it creates stress and bloating, gas, motility problems. So the first thing you have to do is one, make sure the food is good and healthy and you're not loaded with food allergens like gluten. And then number two, you're able to break it down. That's the first thing out of the gates. And then you can go deeper after that. But if you put bad foods in and you have a hard time breaking them down, it's a double-edged sword. I had a gallbladder full of gallstones and they all came flooding out one day. But ever since then, I've been very sick. Any ideas? Well, impossible to say because your body doesn't function. Your body functions and dysfunctions together. So it's very rare that everything is going wonderful in your body except the gallbladder, right? So when you have gallbladder inflammation, there's probably a whole bunch of other things going on, and you really need a good functional medicine doctor to prioritize everything. So I kind of have my 6 R's that I use that kind of helps guide me on the prioritization scale. So the first thing is we're getting the foods right. We're removing all the food allergens and we're really making sure we can break down and digest the foods. And some of that may be adjusting some of the fat in there, even though fat's really good, especially high quality animal fats. Some of the monounsaturated fats are great. The question is, can we take them without creating a gallbladder storm or gallbladder inflammation, right? That's really key. The second is we're getting the enzymes right. We're getting the acids right. If we can tolerate acids, we're going to get bile salts right as well. The third, we're going to really work on getting the hormones dialed in. If you're a female and you have high levels of estrogen, right? So the whole, like, and this isn't me that made it up. General surgeons done this for a year. They call it the 3 Fs: female, overweight or fat, and 40. So this is the big commonality. Now, why is that commonality a big thing? I think it has to do with high levels of estrogen. Estrogen makes that bile much more studgy, and it can increase the chance of crystallization. And the more crystals, the more stones you have, the more stones your gallbladder contracts, it creates inflammation. So when I'm working with my female patients, one, we have to get the weight down. So that's insulin resistance, because high levels of insulin make things more sticky. And we have to make sure the estrogen dominant is fixed. And then just the 40 is kind of like, I think a lot of these things take time to accumulate. So when you have compounding insulin issues and hormonal imbalances over time, it just things magnify, right? So the age isn't necessarily a big thing. It's really the estrogen dominance and it's the high levels of insulin. And women, because they have more estrogen than men, they're just going to be more predisposed. And so we got to look at the hormonal component. Most doctors totally ignore that. And this is the thing I see general surgeons all the time, use that analogy. Okay, very good. Question here. I heard HCl can help bulk narrow stool. Is that true? I mean, it's going to help break down your food. It's going to activate enzymes. The enzymes are going to help break down the food. And then the acidity is also going to help break down the food. And it's also going to help sterilize the gut and prevent bacterial overgrowth. Do you have a video on estrogen dominance? Yes, I do. I have a lot of them. Go to the YouTube channel, youtube.com/Justin Health, and put a little search term in there like estrogen dominance, and you'll get it. And so in my line, we use Liver Supreme for the bile. We're going to use HCl Supreme for the HCl. I have a Digest Synergy that I use. That's a lower dose HCl with more pancreatin in there if someone's sensitive to acid. And then we use the enzyme Synergy. I combine those two and I customize them all one by one because when people have gut issues, a lot of times they're very sensitive to the acid and to maybe to the enzyme. So I customize it one at a time. We work on all the gut stuff first with food, get the food right, and then kind of dial that in a few days later. Okay, let me have questions I got here. Any more else? What I got? Dr. J, what's causing my histamine attacks leading to histamine intolerance? Well, I mean, the first thing I would say out of the gates is going to be get your food right, get your inflammation right, get the gut bugs under control, and then you can really cut the inflammation down. And then from there, you can also really go low histamine, but you really got to cut the inflammation down with your diet, autoimmune paleo out of the gates, and maybe low histamine, and then work on the gut. You got to really dive in deeper. All right, guys, hope you enjoyed today's video. If you did, please give me a thumbs up, share with family and friends, put your comments below. Again, if you want to work with myself and or colleagues, we're available all around the world. Click down below for a consult. If you need that support, I am here for you to get to the root cause of what's happening. If you enjoyed it, give me a thumbs up. Appreciate it, y'all. Have an awesome day. Take care. Bye now.